Hi, my name is Njayo Bala Cynthia, Synthia. Yes, my student ID. I'm going to scan 360 degree of the environment. Hello, my name is Cynthia. I'll be your nurse for today. Um, Looking at your vital signs, your heart rate is 105, which is abnormal. Your BP is 167 over 100, which is also abnormal. These abnormalities could be an indication of hypertension or that there could be a cardiac issue. Your temperature is 37 degree, which is normal. Your respiration is 20, which is also normal. So I'll start with the GI and cardio assessment questions. Do you have any shortness of breath?
I don't think so.
Any chest pain?
I have an ache in my upper chest.
Any palpitation?
No.
Any edema?
No.
Any cardiac history?
I take pills because my cholesterol is high and so is my blood pressure.
Any abdominal pain?
I have a stomach ache.
A nausea or vomiting?
I am nauseous and I did vomit once.
How is your appetite?
It is good.
How is your bowel habit?
It is normal.
Okay, so I'm going to perform LPQRSTU pain assessment. At this point, I'll start with the inspection of the chest. So looking at his appearance, he appears unwell, no increased works of breathing. His color is appropriate, no with his ethnicity, no cyanosis observed, and there is no obvious position. And so looking at his abdomen, I'm going to inspect his abdomen. The color of his abdomen is appropriate. There is no pallor. The contours, looking at the contours, the abdomen is round. It is symmetrical, no lumps. The skin has no rashes, no lesions. So I'll move forward with palpation of the pulses. So I'll start with the carotid pulse. So it is strong plus 2 bilaterally. So the brachial is strong bilaterally. Radial pulse is strong bilaterally. The femoral pulse strong bilaterally, and the dorsalis pedis is also strong bilaterally. So I'll go now to auscultate the abdomen. So I'll do the auscultation before palpation. So auscultating the abdomen, I'll be using the diaphragm of my stethoscope, and I'll start with the right lower quadrant where you can find the appendix. So the right upper quadrant, you can find the liver. The left upper quadrant, you can find the stomach. And the left lower quadrant, you can find the descending colon. So I'll then palpate the abdomen. So I'll be using 2 to 3 fingers to palpate the abdomen, and I'll go to depression of 2 centimeters, moving circularly, and starting with the quadrant that is further away from pain, and I'll palpate the abdomen. Do you feel any pain?
No.
Okay, so now I'll do my chest auscultation. So I'll be starting at the aortic. I'll begin my auscultation using the bell of my stethoscope to check for heart sounds, murmurs, and breaths. So at the aortic valve at the right second intercostal space, the pulmonic valve, the left second intercostal space, the Earth's point, the left third intercostal space, tricuspid valve, the left fourth intercostal space, the mitral valve is at the left fifth intercostal space at the mid-clavicular line. This is where I'm going to take my full apical pulse for 1 minute. So that's done. Just going to call the doctor now. Hello, doctor. I'm here with your patient. My name is Cynthia. I'm calling from the ER. I'm here with your patient, a 63 years old female patient complaining of fatigue, chest pain, epigastric pain and shoulder pain. So she has type 2 diabetes and has been operated. Her gallbladder was removed 2 years ago. Brothers and sisters are fine. On assessment, the heart rate was 105, BP 167/100. I've given comfort measures, and I wish that you come reassess this patient. So from this from the scenario, you could tell that the patient is having a myocardial infarction. As a nurse, I'm going to continue monitoring and reassessing the vital signs of this patient to make sure that I rule out any further concerns or symptoms, and I'm going to administer pain medication as prescribed. Also, I'm going to monitor for cardiac activities. For this, place a cardiac monitoring to monitor for cardiac activities. So the doctor may recommend a cardiac enzyme test to rule out MI or electrocardiogram to check for the structures and functions of the heart. Thank you.